Turning 65 is often framed as a finish line for healthcare costs. There is a baseline expectation that once you enroll in Original Medicare, the financial burden of aging is finally managed by the state. That system is divided into two primary parts. You have Part A, which handles hospital insurance, like inpatient stays and hospice care, and Part B, which covers medical insurance for doctor visits, outpatient services, and durable equipment. However, the government does not cover the full bill. For most Part B services, Medicare pays 80% of the approved cost, leaving you responsible for the remaining 20% coinsurance. This 20% gap is particularly risky because Original Medicare has no out-of-pocket maximum. Unlike most private employer plans, there is no annual limit to how much you can be required to spend. To see the impact of that math, imagine a $100,000 medical emergency. Medicare would pay $80,000, but you would be billed for the remaining $20,000 out of your own savings. Medicare Supplement insurance, or Medigap, was created specifically to fill these holes. These private policies are designed to step in and pay for the deductibles and coinsurance that Medicare leaves behind. Relying on Original Medicare alone leaves you exposed to unlimited financial liability. The system provides a foundation for care, but it requires these supplemental layers to prevent a single health crisis from creating life-altering debt. Using these two systems together is a coordinated process. At the doctor's office, you provide both your red, white, and blue Medicare card and your private Medigap member card. The billing cycle begins when the provider sends a claim to Medicare. The government reviews the service, approves the Medicare-approved amount, and pays its primary share. Once that primary payment is made, Medicare's internal system automatically triggers a crossover claim. The remaining balance is forwarded directly to your Medigap insurer, which pays the gap to reach a zero balance. This specific administrative link only exists within Original Medicare. If you choose a Medicare Advantage plan instead, you cannot use a Medigap policy to cover your copayments or deductibles. This design provides a level of administrative automation that removes the patient from the middle of the transaction. The software handles the coordination between the government and the private insurer on your behalf. To protect consumers, the government standardizes Medigap plans into a lettered system, labeled Plan A through Plan N. Every policy with the same letter must provide the exact same legal benefits. If you buy a Plan G from one company, the medical coverage is identical to a Plan G from any other company in your state. Even though the coverage is identical, insurance companies are free to set their own prices. This results in vastly different monthly premiums for the exact same set of benefits. These price variations are determined by which of the three mathematical models an insurance company uses to calculate its premiums over time. This table shows how those models function. Community-rated plans charge everyone the same premium regardless of age. Issue-age plans set your rate based on how old you were when you first enrolled. Attained-age plans, however, tie the price to your current age. The data for Mrs. Anderson in the bottom row illustrates the risk of the attained-age model. While her starting premium is low, the cost is programmed to increase every single year as she gets older, regardless of her health. Since the medical benefits are fixed by law, selecting a plan is a long-term financial calculation. Success depends on looking past the initial quote and evaluating the math behind the premium's growth. Your ability to access these protections is restricted by a rigid timeline. The entire Medigap system is gated by a single, unrepeatable countdown. Your Medigap open enrollment period is triggered the first month you are age 65 or older and enrolled in Medicare Part B. This window remains open for exactly 6 months, then it's gone forever. During this time, you have guaranteed issue rights. Insurers must sell you any plan at the normal price. They cannot use medical underwriting to deny coverage or charge for pre-existing conditions. If you miss this 6-month window, the legal landscape changes. Companies can then use your health history to set your rates, and they have the right to deny your application entirely if they deem you too high of a risk. A Medigap policy is the primary tool used to secure your finances against the gaps in Original Medicare. However, the system only grants you full access to that shield if you act before the one-time enrollment window closes.